Hello, Assalamualaikum, and a very good morning to everyone. Greetings from Malaysia, Kuala Lumpur. My name is Anis from Medical Division in Ministry of Health Malaysia. I'm a public health physician specializing in occupational health since 2007. My task is in the Ministry of Health is to look at the safety, the health and welfare aspects of our healthcare workers in 147 public hospitals in Malaysia. We have 283,000 healthcare workers altogether, and 2/3 of them are based in hospital setting. So I was invited to talk about occupational health of healthcare workers during a pandemic. So thank you to the organizer for inviting me to give this some points on this topic. Thank you. Mental health issue is now becoming an agenda, not only to the organization but also to the government. A good mental health doesn't mean that you always feel happy or that you never had bad moods or bad days. A good mental health might have a different meaning to each of us, but generally it means being able to think, to feel, and to react in an appropriate way. Based on the hierarchy of control in OSH, I think it is impossible to eliminate the mental health problems in our organization. But we promote some control measures to maintain a good mental health by engaging in activities that provide them with a sense of meaning and importance that will help them to think and boost up our confidence, their confidence and self-esteem. Substitution is also the element that we also consider in maintaining mental health by updating information on the disease, for example, by following a trusted channel. This action can avoid unnecessary stress and confusion. We in Malaysia, Ministry of Health, we use toolbox meeting or brief gathering just before starting the work rounds, for example, to give the latest update on what's happening lately. Thirdly, enjoy your free time with your family or friends. Use the technology to communicate with your loved ones even when you are on call. Social contact is very important here because positive relationship can boost up morality and confidence. Fourthly, try to calm yourself using multiple ways. For example, box breathing, yoga, writing up something about yourself, good things about yourself achieved today, and so on. There are lots of apps and video about calming yourself. I also encountered a study by a university in Malaysia, a study saying that spiritual support is important, making sure that they have time to indulge with spiritual activities. And lastly, don't forget to eat healthy meal regularly. Avoid using drugs, alcohol or tobacco that can worsen your mental and physical well-being. In my opinion, different groups will gain different experience. It is shown by several studies on the psychosocial status faced by the healthcare workers during the pandemic. For example, a young doctor with less experience handling patients will have rather heightened anxiety compared to a physician who has been working with all kinds of infectious disease for quite some time. However, older staff reported increased stress due to exhaustion due to prolonged working hours. There's a study by National Institute of Health found that younger age group between 31 to 40 years were more worried about infecting their families, whereas in staff more than 50 years of age, patients' death caused more stress. One study from our local psychiatrist here showed that the burnout among healthcare workers are very prevalent. The study was on an online study using a Copenhagen Burnout Inventory, CBI, involving public and private healthcare facilities with multiple categories of workers involved. The study indicates that more than half of our healthcare workers experience burnout during the COVID-19 pandemic, either due to personal, work or patient-related burnout when they are directly involved with caring of COVID-19 patients. Several key factors identified, such as younger healthcare workers, those with medical conditions, support at work, childcare support, long hours of working, and spiritual routine. Burnout was highest among health inspectors and also healthcare workers in medical lab. This is because of the demand of contact tracing by the health inspectors and also testing by the healthcare workers in the medical lab, which they came in bulk from all over Malaysia. And patient-related burnout was highest among paramedics and healthcare workers in private hospitals who need to attend the patient continuously for 12-hour shift and sometimes beyond the shift. There's another study on depression and suicidal ideation. Being a female still in early to mid career seemed to be at high risk of suicidal behavior. However, having a longer duration of service, more than 10 years, appeared to be protective against suicidal ideation in Malaysian healthcare workers during the early phase of the COVID-19 pandemic. All right, there are a few measures to ensure health and behavioural status of healthcare workers in the setting of COVID-19. Firstly, I will say establishing policies is very important to ensure appropriate and fair duration of deployment, working hours, rest break, minimizing the administrative burden on healthcare workers. Then define and maintain appropriate safe staffing levels within healthcare facilities. Last but not least, establish a blame-free and good working culture. Though open communication, including legal and administrative protection from punitive action on reporting adverse safety events. We should provide access to mental well-being as well, and also social support service for our healthcare workers, including advice on work-life balance and risk assessment and mitigation. For example, psychological first aid or PFA is now important in Ministry of Health to limit distress and maladaptive behaviours that could negatively impact the healthcare workers of traumatic experience they were facing. Yeah. During the pandemic, working in a hospital at this time can cause significant stress to healthcare workers. They do burn out. So they, as much as possible, will try to avoid contact with patients. Of course, the psychological training of healthcare workers using an old method of classes or seminar or workshop are not really going to be effective at this moment, because it is not really appropriate to do so in such hurry condition and needs manpower and also time consuming and physical contact. So the alternative for this is, of course, through an interactive session using computer assisted training course. This is definitely less expensive, easily accessible to our healthcare workers. They can check in during their recess time or during their off shift or during their off day. I myself experienced this session organized by a Korean university during the first phase of the pandemic. It really helped me to understand about the disease, reduce anxiety of uncertainty, and prepare myself mentally on what to expect in a few months' time before the cases shoot up. Definitely, it boosts up the confidence in managing the COVID-19, stimulate the coping skill during the outbreak, and also ultimately can reduce the feeling of stress when handling the positive patients. However, the duration also plays a part. It cannot be too lengthy, too wordy, and must be interactive enough to get the participants' attention. Yes, cognitive behavioral therapy, or we call it CBT, is an evidence-based psychological treatment aiming at relieving immediate stress and preventing the onset of psychological disorder. It can be understood as a talking therapy that can help you manage your problems by changing how you think, how you behave. CBT is based on the concept that your thoughts, your feelings, physical sensations, and actions are interconnected, and that negative thoughts and feelings can trap you in a vicious cycle. In Malaysia, CBT is prescribed according to the assessment and need of the patient, including our healthcare workers. However, this approach to CBT session held physically before this, face-to-face, had been shifted to online CBT session during the pandemic due to movement restriction and to prevent the spread of the pandemic. Interestingly, fewer studies have demonstrated that online CBT has proven effective in treating and preventing stress-related disorders. It also provides the flexibility required to facilitate access to the healthcare workers. As you can see, pandemic COVID-19 that hit globally had resulted in disruption of health service delivery. From rapid assessment even conducted by WHO, 3/4 of the countries reported a considerable degree of disruption to NCD services. For example, screening, case identification, and referral systems for cancer have all been affected by the COVID-19 pandemic, which has resulted in decrease in cancer diagnosis, for example. The cancellation of elective surgeries caused devastating consequence to the increase of complication in the patients. So firstly, the most widely used strategy implemented in over 2/3 of the countries and also in Malaysia has been triaging. Triaging is the effective system which help in the response planning and case management system to cope with the patient influx to the hospital and protect the safety of healthcare workers. Our triaging system starts from the community level, whereby the community NCD nurse and doctors identify those who are at high risk developing severe complication from their NCD problems. The algorithm of triaging is managed up to tertiary level of care. Secondly, the mitigation measure was to increase the use of telemedicine or teleconference. The primary care physician here relies most on this method for consulting cases. Besides that, the doctors themselves use this platform to communicate with the patient. Among the countries reporting service disruption, 58% are now using telemedicine to replace in-person consultation. Online information on wellness class, healthy diet, drug consultation is all being done virtually. In addition, using telemedicine is now used to maintain continuity of care for people living with NCD. Thirdly, the Ministry of Health Malaysia prioritized community-level services in a safe way to cater for NCD patients' needs. We have seen tremendous work done by our family medicine specialists and also private practitioners at the local level or community level through public-private partnership. They work on maintaining the care to improve population health in the community. Furthermore, we are also prioritizing NCD patients and healthcare staff for COVID-19 testing. The policy of the ministry is to ensure those who are admitted to the tertiary center and also the healthcare workers are free from COVID-19, therefore reducing the possibility of transmission in the ward or clinics. NCD prevention and management is a key to improve population health and mitigate the impact of any future crisis. All right. Long before the COVID-19 pandemic in 2013, the Ministry of Health Malaysia established a very comprehensive community-centered public health policy which aimed to build healthy, resilient, connected and empowered communities in improving the population's health. It is called COSPAN or Healthy Community Policy. The strategies are focusing on curbing the NCD in our country. But during the pandemic, the government realized that community empowerment is also vital. Therefore, early last year, Malaysia launched My Sejahtera application on mobile phones. My is a short form for Malaysia. Sejahtera means prosperous, meaning prosperity of Malaysians. This application was developed as a tool under the Prevention and Control of Infectious Disease Act 1988 through the strategic cooperation between the National Security Council of Malaysia and the Malaysian Communication and Multimedia Commission. The introduction of My Sejahtera is one of the excellent tools developed that empower the public to be actively involved in the management of COVID-19. The app provides vital information for users throughout the COVID-19 outbreak, such as how and where to seek treatment if one is infected with COVID-19, and the nearest hospitals and clinics for screening and treatment. In addition, the app also allows users to perform health self-assessment on themselves and also to their families, monitor their health progress and enable the Ministry of Health to monitor users' health condition and take immediate action in providing necessary treatment to those in need. Yeah, I agree that musical therapy has benefited a lot to our healthcare workers and now is becoming a part of our intervention to overcome the stress among them. Scientifically, music, of course, they release dopamine in the brain and you feel good about yourself. The positive result may be seen on a long-term basis and it improves the healthcare workers' self-esteem as well as communication skill, creativity and motivation. Also, there are studies show the effect of musical therapy as well. Those who receive would show a reduction in depressive symptoms as compared to those who receive usual care. Why is that? Because music offers comfort. Music also boosts up our energy and mood. Music offers social importance, therefore improving our mental health. I would say the same goes for scenario-based stimulation training. It will improve our confidence in our healthcare workers, especially those handling challenging tasks such as handling complex patients, risky procedures, etc.